Good morning, everyone, and thank you for joining us. We are here to update the public on the status of our discussions with the Chicago Teachers Union leadership on reopening safe, in-person learning for our students and families. I've said this before, but I think it bears repeating that we have no higher purpose than ensuring each and every one of our students have the resources they need to succeed and thrive. After over 80 sessions with the Chicago Teachers Union, I think it is critically important that we not lose sight of a few important points. First is that our schools are safe. We have repeatedly said throughout the pandemic that we would be transparent and guided by the data and the science, and we have been. We've had almost 3 weeks of successfully implementing the COVID-19 mitigation plans designed in partnership with the Chicago Department of Public Health and following the CDC guidance. National expert after national expert, including Dr. Anthony Fauci, has repeatedly said that with the kinds of mitigations CPS has put in place, schools are safe. And we all know that to be true based upon our actual in-person experience. And let me remind you of the over $100 million in mitigations that CPS has invested in our schools to make them safe. They included ventilation, testing, health screening, face coverings, enhanced cleaning, and other in-school safety measures. And as the expression goes, the proof is in the pudding. CPS had 3 weeks of successful implementation of these mitigation plans in our schools. That was until the CTU blew up that success and created chaos that we are now enduring. And also remember, the CPS staff and principals have been in our schools throughout this pandemic, feeding our kids, getting them ready for the return of students, and continuing the hard work every single day. And oh, by the way, there are teachers that are still coming into our classrooms to teach because they know it is safe as well. Now, we do not have a deal to report this morning, but we will remain at the table in an effort to get a deal done. The ball is in the CTU's court. Despite a series of productive exchanges between CPS and the Chicago Teachers Union leadership on Monday and Tuesday, that should absolutely have led to a comprehensive agreement yesterday, we are deeply disappointed to announce that we still have not reached a deal. Yesterday, there were a series of steps backward that were simply not productive, and we have conveyed that problem to the CTU leadership in the strongest terms possible. We waited for hours last night, hours, and still did not receive a proposal from the Chicago Teachers Union leadership. And as of this morning, we are still waiting. But to be clear, not patiently, not anymore. After 80+ meetings and going above and beyond to address the CTU leadership's various issues and concerns, we are out of runway. And let me give you a sense of what we have put on the table. We have a comprehensive vaccination plan developed by Dr. Arwady, which is sensitive to the unique demands of our communities. We have provided ADA accommodations for those CTU members who themselves have underlying medical conditions or are the primary caretakers for household members who do. We have offered to accommodate the CTU members who do not fall into one of the two above categories, but do have a household member who has a health risk. We have driven agreements in 5 areas on safety and health protocols, ventilation, testing, contact tracing, and joint safety committees. But still no comprehensive agreement. We are still waiting on the CTU. How is there time to orchestrate press conferences and letters, but not a focus on getting a deal done? Let me just add that We are here today talking about these issues in the midst of a backdrop of a citywide positivity rate of just 5%. These schools are open and safe, and we are ready to welcome our students back. And frankly, they've been ready for some time. All we need now is the CTU leadership to get serious and meet us at the finish line. This week is finals week for our high school students. In support of them and to avoid any further disruption, we extended our cooling off period through the end of the day today, as Friday is a previously set non-attendance day. We've extended ourselves beyond measure out of empathy for our teachers in this very difficult time. And we will continue discussions to address the remaining issues as quickly as possible in our further effort to avoid a catastrophic disruption to our school system. But let me emphasize again that time is running out. We need our kids back in school. We need our parents to have that option. It should not be that CPS parents of all the schools in our city are the only ones who don't have the options for in-person learning. It cannot be so that a public school system denies parents that right. And let me emphasize again, while remote learning works for some, it absolutely doesn't work for everyone, not by a long shot. And I'm going to keep repeating these numbers and metrics because they are devastating and should create a sense of urgency in all of us to do the right thing for our kids in this difficult time, black and brown kids who look like me, coming from circumstances like the one that I grew up in, who are struggling and are failing. We are failing those children by not giving them the option to return to school. Failing grades, depression, isolation, and so much more. That is why we must get a deal done and get it done now without further delay. So let's do it. CTU, let's do it today. Let's get a deal done. Enough is enough. We have everything, more than, to make that happen today. And we simply can't afford to wait any longer because our children cannot afford to wait any longer. All of us are hearing from parents and students all over Chicago who feel like they are being held hostage and that their interests are being disregarded and drowned out. And I fully understand their frustration. If we step back for a minute and think about where we have traveled, every resident of the city has been carrying a heavy burden over the past 11 months. Despite the once-in-a-lifetime series of challenges we have all experienced, we have been incredibly resilient as a city. And we do have light at the end of this very dark tunnel. But it is important for our city's recovery to safely reopen our schools so that our students and families, particularly our most vulnerable, for whom remote learning is not working, have the real options that they deserve to get the education that they deserve, to allow our parents to return to work. I want to express our deep thanks to the CPS families and their patience during this incredibly difficult and frustrating time. To those who have expressed concern, I want you to know that we see you and we hear you, and we are working as hard as we possibly can to get a deal done because we know that's in your best interest. This has been frustrating, and I'm asking you to hang on just a little bit longer and be patient. But my patience for delays from the CTU leadership is over. I know that parents out there are juggling a lot of different responsibilities, that it's really hard to manage remote learning. It's just hard to manage, period, in this difficult time. A lot of uncertainty and instability, and we get that. What I'd ask you to do is to focus on the truth. We are going to be transparent, as we have been from day one, and particularly during this pandemic. We are going to give you the facts. We're not going to fearmonger. We're not going to spin you. We're not going to fill your inboxes with propaganda. We're going to be straightforward and tell you like it is, because that's what you deserve and that's what you expect from me. We will get through this, I am confident, and we will be on the other side of this. But we need to get this deal done and get it done today without further delay. I've expressed that to President Sharkey in very direct terms. I expect to hear from them. No more delay. We spent hours and hours. I've heard from parents, why did you not let us know last night sooner? Because we were waiting on the CTU. And on the off chance that we had the ability to actually get a breakthrough, we wanted to be able to share that news. But we waited and waited and waited and waited. Time's up. Let's get a deal done. Dr. Jackson.
Thank you, Mayor, and good morning, everyone. Today marks the end of the first semester for Chicago Public School students. For the past 20 weeks, our students have been learning remotely and learning at home. It goes without saying that this is the most unusual and challenging start of the school year in all of our lifetimes. And we want to make sure that our students, those families that want an in-person option, have some sense of normalcy in return to in-person instruction, as it is our duty to offer them that choice. Since the beginning of this pandemic, the district has been responsive to the needs of our students and families. That started with standing up a remote learning program, and I want to thank our teachers for their creativity in doing so. The school system worked to provide devices as well as internet connectivity for families who could not afford it. We've done everything within our power to make sure that our students continue learning throughout this process. But we know, as the mayor said in her comments, remote learning does not work for everybody, nor is the remote learning the plan for education in Chicago Public Schools going forward. At some point, we have to return to in-person learning. Remote learning will never match what happens in a classroom. Our students have done their best. Our parents have been there throughout the process, but the time is now to see our students back in the classroom. I hear from essential workers with young children who can't afford childcare, who have to manage both remote learning while also keeping our city running. I hear from parents of students with special needs or younger children who say they have to stay at the table all day to support their children in order to make sure that they're getting a quality education. And I hear from countless Black and Latinx families whose children are falling behind and who are not thriving nor managing throughout this process. And again, this is personal to me. As I stated before, my daughter was supposed to return to school with 70,000 other students on Monday. We're now 4 days into this week at the end of the semester, as I pointed out earlier, and the time has run out. We must reach a deal for the sake and sanity of our students, parents, teachers, and the hardworking employees in Chicago Public Schools Central Office, all of whom have been working extremely hard to make sure that this plan works. As the mayor said in her remarks, and we've been saying throughout this, the science is clear. We've said from the beginning we're going to follow the science. And it bothers me that we continue to see people disregarding what the scientists such as Dr. Fauci, Dr. Arwady are saying, and even as early as yesterday, the head of the CDC. It is clear that we can do this with the proper mitigation strategies in place. The district has invested over $100 million to ensure the health and safety of our students and families. There's a mountain of data and studies that show with the proper protocols in place, schools are safe places to be. At this point, finding a public health expert who opposes in-person learning will be like finding a scientist that doesn't believe in climate change. We have to move past this debate of whether or not schools should be reopened and focus our energy, time, and resources on doing that safely. Our parents want to know what's going on, whether they have chosen in-person or remote. And to the mayor's point, we need to get a deal done today. At this time, I think it's important that we all act in the best interest of our students and families, as well as the educators, all of whom are in limbo and waiting for a decision and a resolution to this issue. At this time, I'll now ask my colleague, Dr. Arwady, to come to the podium to give a brief update on some of our vaccination efforts.
Thank you, Dr. Jackson. So just briefly, we continue to make excellent progress both against COVID and toward vaccination here in Chicago. We currently, as you heard the mayor say, are at a 5.4% positivity here in the city of Chicago. We are averaging just 539 new cases each day. Let's put that in context. At the peak of our second surge, we had a 16% positivity. We had days with more than 3,000 new cases. This is the best shape our city has been in from a COVID perspective since the beginning of October. Secondly, we are making excellent progress on vaccinating people. We are turning the vaccines we receive into vaccinations, and that includes teachers and other frontline essential workers who already are being vaccinated and who there are plans to continue to vaccinate just as quickly as we continue to receive vaccine. So we have, as of today, here in Chicago, administered 256,279 vaccine doses. I'm happy to say we're over the 6% threshold for all Chicagoans, so 1 in 17 Chicagoans has already gotten at least their first dose of vaccine, and 1 in 8 Chicagoans over the age of 65 have gotten that first dose of vaccine. We've worked with Chicago Public Schools, just as we've worked with other large employers across the city to make plans for their frontline essential workers to be vaccinated. There are already more than 3,700 CPS employees who have either been vaccinated or have been offered dedicated vaccination spots. In addition, there are teachers and others who have managed to secure their own vaccinations, whether that's through the ZocDoc app, whether that's through pharmacies, whether that's through an appointment with their own physician. We are dedicated to getting this group vaccinated, but I want to reinforce that vaccination is not required for safe school reopening. What we have seen across this country is that long before vaccines were a possibility, settings that had positivities 1, 2, 3, 4, 5 times higher than what we have here in Chicago successfully opened schools, did not see them being a source of spread, did not see higher rates among staff or students who were in person in these settings, because we know how to be careful about COVID. We know that you can't have a completely normal in-school experience. You have to have masks. You have to have distancing. You have to have pods so that limited number of students are interacting. You have to pay extra attention to cleaning and disinfection, and all of this, as a reminder, has been in place at schools across Chicago throughout the fall. And before that, this summer, in place across other settings where children gather, daycares, camps, other educational settings. And what we have seen is when these strategies are in place, school, other places where children get childcare and gather, is not a more dangerous place to be than being in the community. And in fact, it is often safer. In addition, CPS, we've worked to really put additional safeguards in place. Routine testing, surveillance testing, already started when school reopened for the youngest children and this cluster children. And we did not see unexpectedly high positivity rates there. We're dedicating vaccine. Teachers and others will be vaccinated along with the many other people who need to be vaccinated here in 1B. But please, as a reminder, we've shown over and over again here in Chicago, across the country, and around the world that schools are just not the source of COVID spread like people thought they would be a year ago. The science continues to evolve, but on this point, the answers could not be more clear. I make a lot of difficult decisions in my role in this city, but this decision, being supportive of school reopening based on the science with the appropriate mitigation plans in place, is not a hard decision and has not been a hard decision for months. So we'll continue to share information about the vaccination efforts, but please know, in good faith, we are absolutely ensuring teachers, CPS employees, are already being vaccinated will continue to have dedicated vaccine opportunities. And we will continue to provide vaccine for as long as there are CPS employees who want to be vaccinated. Thank you.
All right, Sarah, let's start with you on topic. Okay, and I have a ton of questions, so hopefully you guys don't have anywhere to go for a while.
We're not giving you that long. I said today's the day.
I wanted to start out with this question that sort of came up this morning at a press conference. We heard from this is a CTU press conference from a parent whose child has not had a teacher at all in front of them because their teacher was locked out. And I understand that not that many teachers have been locked out, but what do you say to that parent? And also, will those teachers be let back in? Why haven't those teachers been back in? And will you make them whole? Because that seems like paramount to an agreement with CTU.
So that's about 5 questions.
Yes, but it's all
but
in
the
the same
answer is
line.
simple around this. The teachers who have been locked out are teachers who, despite every effort and every opportunity, refuse to report to work and refuse to offer an explanation as to why they didn't report to work. I don't know of any organization, company that would allow for that. And so it's unfortunate. My heart goes out to that family and that parent that spoke about that experience. But I also think there's accountability and culpability for the individuals. You have a responsibility to your employer as well as to your children to tell them why you're not coming to work, to avail yourselves of all the opportunities that we have for people that have legitimate reasons not to come to work. But, I'm not going to allow, political stunt or standoff to direct what we're doing here. The goal is to get children back in school. There is a lot of disruption going on, and I hope we give a lot of attention to all of the families whose lives are being disrupted by this plan. There are
to
thousands.
not have a teacher in front of a student. I mean, they're not saying that they had a sub. They are not. They have SICAs teaching this special education class. I mean, that's against the law. I mean, these kids have IEPs that have to be followed.
We have substitutes in front. If there is a situation where there isn't a substitute, that's something that should be reported to the network chief that we will handle individually. But you asked about, on whole, the teachers that have been locked out. We put in a plan to backfill. I can't tell you if a substitute failed to show up one day or a couple of days, but if they did, that should be reported and it will be addressed.
Okay, my next question is if you guys can explain a little bit better about the new accommodation policy and how that aligns with vaccines. There is something about 20% of people with who live in households can stay at home. It's sort of confusing to what you guys are offering, so I just want you guys to explain it a little bit.
It's actually not confusing whatsoever. For those individuals who are CTU members that themselves have underlying medical conditions or are the primary caretakers for someone who does, they've been accommodated. Thousands of individuals have been accommodated. CTU has asked for more, particularly for those individuals who don't fall into Category 1 or Category 2, but have someone in their household that has an underlying medical condition. We absolutely understand the concerns there. We have put a plan on the table for accommodations and for vaccines for that category, which is about 2,000. That's been on the table for days.
So
and
these
we
are,
need, so
just to clarify, that's 2,000 that are the ones that are like live in households, but they aren't primary caregivers and they don't have medical conditions?
That's correct.
So those are, and so those are the only people, and it's 20% of them. How do you choose which 20% of them
So no,
are
no,
in
no,
that
no.
category?
That you're going off on in another direction. It's very straightforward. So
all of them
hold on.
are-
Let me just. It's very straightforward. Let me just answer. For those 2,000, we have offered a very specific plan, including getting dedicated vaccine resources for them so that they can get vaccinated quickly and address the issues in the household. We're offering, obviously we have no idea, neither does the CTU, as to whether or not that category of 2,000 will actually take up the vaccine, but that proposal has been on the table now for days, and we are still waiting to get a definitive answer from the CTU.
You guys said after one dose they either can come back or take in.
So I'm not going to get into that level. I'm not going to bargain with you here at the table, Sarah. I'm really not. That's not appropriated.
Some of the
I'm trying to
thinking behind that.
I understand, but let me just finish. I know you're not normally here, and so we are not in a cadence together yet. But I'm not going to bargain here. I'm giving you broad strokes of what the proposal is. We put the proposal on the table. Of course, there are nuances, but it's pretty straightforward. And we need an answer from the CTU.
Can you talk to me a little bit about the timeline that you guys now see in returning kids to school, and whether you now are thinking about grade bands and how soon that would sort of kick in? Because that seems like a big disagreement between you guys, the two sides.
We have literally bent over backwards to try to be as accommodating as we can and address a number of the concerns that the CTU has raised, even as the goalpost moves and moves and moves and moves. And today is the day where we need a definitive answer on all of the outstanding issues.
Timeline issue. What is your thoughts now about when students
I'm just going to ask.
be back in
I'm just going to
school?
ask, just as a courtesy,
Yes.
for you to let me finish, and then we can absolutely. I'm here. We're here to answer questions, but it's a little hard when you're ready to move on when I haven't finished actually answering a question. Is that fair?
Sure.
Okay. Ask your next question.
I want to ask again about the timeline. When do you guys expect for kindergarten through third grade, fourth grade through sixth grade to be back in school? So obviously it's not February 1st. So
We expect them to be back in school as quickly as possible, and we've made that really, really clear. As I said, we're out of runway. We're right here at the finish line, and we need CTU to join us and go over the threshold, hopefully together, hopefully with a comprehensive deal.
Okay, one of my colleagues asked that in the month of January, Chicago Public Schools' online case tracking system shows 163 cases of staff COVID-19 cases and 15 among students. Should those be numbers understood as minimal spread, as schools were only open with a fraction of students during this time? And how does that square with your understanding of schools being safe?
Dr. Ari will address your question.
So the question is not whether we ever see COVID cases in school settings. The question is whether we see the spread of COVID in school settings. And so just as we have been doing for every case that we've seen in school settings, daycares, schools that have been open, camps, athletic teams, there's a dedicated pediatric team at the Chicago Department of Public Health that works to do an investigation and to understand, what is the risk factor? Is there concern for spread in any given setting? And with CPS, we work with their contact tracing team that works within the school. We also look at risk factors outside the school. And we've posted, and I would refer you, every week we do post the number of pediatric cases, for example, that we see in school or camp or daycare settings. In comparison to the number of pediatric cases we see across the city, it is very small. It's like less than 5% of the pediatric cases that we see are in any kind of school type setting. Similarly, when we look at staff, we have not seen rates of staff or adults that are in school settings that are at all above the rate that you would expect to see based on the rate in the community. And we did this study, right, looking at the Archdiocese. With CPS not in person, the Archdiocese is our next largest system. It is the largest private school system in the United States, and worked throughout the fall as they were open, looked in detail at all of the cases that, again, we saw cases. The average number of cases that get reported out of a school is 1. Because somebody gets infected, brings it in. And most commonly, where we saw more than 1, it was in siblings, or it was in a parent and a child who may be a teacher and a student. Could count on one hand the number of times that we could not rule out that there may have been a transmission within that school setting with no serious outcomes. So we have not seen outbreaks. We have not seen schools broadly be a concern across the city, across the country, around the world. And that is why you've heard the CDC, Dr. Fauci, increasingly really point that we want schools to be open, because we've shown, we know the negative impacts of schools not being open, and we've shown that with mitigation measures in place, they absolutely can be. So we continue to work, and I just want to make the point that whenever somebody is identified with a potential association with a school, we ask those people to participate with contact tracing. If we're reaching out and having a conversation, this is just to make sure we understand what exposures may have been, make sure we're doing the appropriate notifications, quarantine and isolation. That's an important part of keeping schools in any setting, any work setting, safe in Chicago, and we have not seen anything unexpected in those numbers.
Sarah, 2 more from you, and then let's let Mary Ann go.
Okay, I'll ask this. This might be for everybody again. Many schools in Europe, in Britain, Portugal, Denmark, and Austria have reopened schools and now
Definitely for Dr. already.
and now are reclosing them because of the variant. They say that the variant is really going to take hold in March. And I think this also kind of goes to the public health metrics that the union has been pushing for. You know, are you worried that come March we'll wind up having to reclose the schools because of the variant will be raging?
So, couple points on that. We obviously have surveillance systems in place for variants, and even aside from what's happening at the federal level, here in Chicago, we had invested about $3 million even before these variants had emerged to beef up our ability, working with academic partners, to do more of that specialized testing. And I also want to be clear that these variants are of concern, but if people do the mitigation things that we already know work, the masking, the social distancing, they do continue to have protection against these variants. And so the variants, to me, are a measure of making sure that we double down, that we don't let up just because our numbers are looking a lot better. We don't start having gatherings outside of school. The Super Bowl's coming this weekend. I want people to remain cautious, not be taking unnecessary risks with COVID. We are in the best possible position right now as the variant is starting to emerge because our cases are coming down and have been coming down consistently. One of the reasons we are pushing vaccine into our hardest hit communities and locations in Chicago, why we can't just dedicate all of the vaccine to schools, is because we have to make sure the vaccine gets in the places that decreases the risk and the spread in Chicago, because every time we see spread in Chicago, that is an opportunity for a variant also to spread. And so the variant conversation for me is not about sort of the opening or closing schools. We have seen that with the mitigation, and even they've done additional work with ventilation, there's been a lot of work in these settings. I do not have concern at this point related to the variant and making it unable for us to have schools reopen. I do have concern about making sure we're driving vaccine into the places in Chicago that are most driving our outbreak, so that we're all the best protected as possible as these variants likely may emerge.
Okay, then my final question is going to be about how likely do you think that there will be a deal? I know you want one. Everybody wants one, but how likely? If not, what is what can you really do? Because we've seen that you do not want to strike. I don't think the union wants to strike. What can happen here?
Well, what I'm really focused on, and what I've made very clear, is we need to get a deal done today. Today.
What if it doesn't get done?
I'm not going to speculate. We need to get it done today. There's no reason why we shouldn't have gotten it done yesterday or Tuesday or Monday. But today is the day. My patience is up. I understand what the concerns are. We have been bending over backwards. I have been personally involved in trying to craft solutions, and partly why we've had the movement that we've made today, this week. But we can't keep taking steps back. We can't wait hours and hours and hours and have no response other than we're working on it. That's not good enough anymore. It's simply not good enough anymore. If we were in December, maybe even in January, but now in February, it's not good enough. No more excuses. Let's get it done and get it done today. That's the only thing I am focused on today. Okay, go ahead, Mary.
This is probably for Dr. Jackson. School administrators have sent me some questions as well, and they're concerned about some of the equipment that has been purchased, particularly what's called an air purifier. They say it's not a HEPA filter, and that HEPA filters are the best. I know so much money has been spent, but can you guarantee to them that the equipment that they've received is really the proper equipment needed during this crisis?
Yeah, I believe yesterday or 2 days ago, we posted a video to talk about ventilation in our buildings at large, as well as these additional measures. So the HEPA filters, air purifiers, which we've said throughout the process, are all extra steps above and beyond what we've done to ensure proper ventilation in our classrooms. I also want to remind people that we committed, and we've published every single classroom in the district, and committed to not having class in any classroom that doesn't have the proper air filtration happening in the schools. So that's point number one. If there are concerns with devices, they can report that directly to their facilities manager as well as the network chief. I have not been made aware of those, but it's something that I'm happy to follow up on. I also want to note that in addition to the things that we've talked about at length at different press conferences, we've also purchased for each individual school that the engineer will have is a device to test the air quality. So any teacher or person that's in the classroom or a space that they don't feel confident in the air quality, the engineers will have devices. Those have started to get delivered to schools. Will have devices to test the air quality and show people in real time what's going on in those classrooms.
We had been asking for a while how many did show up at that first wave, and it turns out that from what CPS has sent to us today, there's only 31 teachers who did not show up of the possible 1,700. And the point you're making is?
Well, I think it's clear. Let's be clear. 31 didn't show up and did not give a reason for not showing up. There were some people who were expected to show that maybe failed the health screener or had traveled, so they needed that time to quarantine per the guidance, or individuals that had other reasons not to report to work. But again, I think I've already answered the question about that. This is an organization. We do have rules, and employees are expected to do what's expected of them from their employer. We have a contract, and we're asking people to honor that and avail themselves of the policies that we have in place to, if they're not going to come to work, they should take advantage of that.
Some of this is the minutia of the contract, but another administrator asking me, what is CPS doing for staff members that contract COVID while working in schools now that the CARES Act has expired and has not been renewed? Will they have to use their benefit days? Will they have to go on short-term disability?
No, we'll continue to pay people if they have to, work from home because of quarantine or contracting COVID. That's always been our policy, and we've had no discussions about changing that.
Mayor, from Amy Jacobson, she is asking, so I know that you've said several times here today about today's the day, but if there is no deal by tomorrow, will you pursue what the city of San Francisco is doing and sue the school district? If not, when will real consequences?
So, apples and oranges. In San Francisco, the mayor has no authority over the school district. So I have no intention of suing Dr. Jackson and her colleagues.
Is this at all a political test of wills between you and Stacey Davis Gates?
I don't see it that way. This is about our kids. This is about our kids. It's about our kids. For me, that's the only thing that matters. And if we focus on our kids and what is in the best interest of them, everything else in the school ecosystem, from the building principals to the cafeteria workers, from the engineers to the janitors, to the support staff, the IT people, all of the people that make up the school ecosystem are there for one reason, and that is to make sure that our children get the best quality education possible so that they will be launched in life with the tools that they need to be successful. For me, that's the only thing that matters.
Why do you think the percentage of black and brown students is much less than the percentage of white students returning to the classroom?
Look, I think there's a lot of reasons for that. And part of the percentages, there's a substantial percentage, and Dr. Jackson or Chief McDade can address this better than me, that just didn't respond. We know there are challenges with our school system. We have a significant number of low-income, single-parent families that are struggling hard every day, pre-pandemic, even more so now. And so we are trying to reach out to them and have the schools be a lifeline for them. Just like we've seen in the early days of the vaccine, a lot of hesitancy, a lot of people waiting and seeing. I'm sure that's some of what's informing these numbers. But we had 3 weeks of success. and we started to see more people come. And I'm confident that when we get past this moment and we reopen again and we see people see the success, more will come.
Can I just throw in a question
Sarah,
here?
it's still Mary Ann's turn.
Just really quick, because it's about this, because I think that the school district.
You're violating the rules here. It's your first time. So say, I didn't hear your question. I didn't hear your question.
I think the school district rules is that nobody can opt in who didn't opt in December until April. And I'm wondering, you guys keep saying, well, we think more people will come.
I
Are
don't-
you
I
guys going to
don't-
change that? Are you guys changing that rule? Because I've heard this at several press conferences, and it's just sort of doesn't really make sense that more people can come, but you guys are saying you can't come till April if you didn't opt in December. Right? Isn't that what the rule is?
I'm just waiting for you to finish.
That's what I'm asking.
Okay. You want to
That's
address
what
that?
the rule is.
So,
We gotta open schools first before we discuss anything else, so I
Right.
think we can move on from that question.
Okay, let's do two more from Mary Ann.
Okay, one I'm just wondering, why the line in the sand now? You know, at 10 o'clock in the morning, of course, you did discuss why, about last night being so frustrated and so many parents, who are scrambling to figure out today. But realistically, there is no school tomorrow anyway. Might we all be back in this spot Sunday night?
there shouldn't, no, I'm not going to be. If you're here, you're by yourself. I'm not going to be. Time's out. Runway, done.
And
We need a deal today.
today could be until midnight tonight, though, realistically. I mean, it could be a long day, are you saying?
It could be a long day, but it shouldn't be. There's no reason why it should be. We have a finite number of open issues. We need a deal. We need them to actually respond to us, not move the goalpost again, not add on a bunch of extraneous issues like defunding the police, right? Those aren't relevant
Did
to
that
this
come
issue.
up?
They've been on a table. Look at their website. They're on there as part of their demand is defunding the police. Absolutely, it's there.
All right, Mary Ann.
Just one, and this isn't off topic, about the new floor leader at the city council. Alderman Villegas, I'm mispronouncing his name.
Villegas.
Thank you. He says your style has made it difficult. Is there a revolving door with your administration?
No. Alderman Villegas and I think, have aligned on a number of issues. He came to me in good faith and said that he wanted to focus on other issues. The style point is this: I don't buy votes. I never have, and never will. And people aren't used to that. But I've been very clear about that. I do not buy votes. We manage every vote to 26. If I wanted to run up votes, I could buy votes. I could offer the taxpayers money to buy votes. I don't buy votes. That's a different thing for folks, and they're still getting used to it. I'm very confident in the new team that we have. Michelle Harris is a beloved and respected, and George Cardenas is a real warrior. Smart, sophisticated, both of them. Very well liked and respected by their colleagues, and I'm enthusiastic. We've already done some great things together just this week since the formal announcement, but started working even before that. So I'm excited about the new team and the possibilities that it brings. But yeah, I'm different in every single way than any other mayor that's ever been here before. That's not a surprise. And so people are still, almost 2 years later, getting used to that. But I say what I mean, and I mean what I say. And I try to walk the walk every single day with my values. And we are pushing people out of their comfort zone. There's no question about that. And many people don't like it. Sorry. I got a mandate to get things done. I got a mandate to shake up and change the status quo. And that's precisely what I've done every single day. And some folks are comfortable with that, some are not. But as I said, I don't buy votes. I'm not here for a popularity contest with the city council. Of course, we want to work with our colleagues. We want to work with them and talk with them and see what their concerns and interests are. And we're doing that. We're doing that. A lot of the back and forth through the budget process last fall, I think, really underscored that. We heard from them. They came to the table in earnest with a number of different suggestions. But at the end of the day, I wear the jacket. And I got to move the city forward. And that's precisely what I will continue to do.
All right, thank you, everybody.